Welcome to JRTV. Now we can discuss about gingival pockets. The causative factors for getting gingival pockets. There will be food impaction in between the crevices of gingival tissue and the tooth surface, and there will be impaction of apple peel of apple piece or any green apple or any food particle or any husk related food items. If there is any enlargement, food enlargement will results in this periodontal pockets, because in between the gingival crevices and the tooth surface, if there is any food impaction or any food particle enter into this gingival crevices, there will be results of the patient will get periodontal pocket. For example, if there is any tartar or caliculus or any hard husk of different pea seeds or all pulses, because there will be husk on pulses, and if there is any impaction of these fibrous layers of pulse, or even drumstick also. Drumstick, after chewing drumsticks, there will be pieces of drumstick residues will impact in between the gingival crevices and tooth surface, will results in periodontal pocket. So the main patient will get so much of pain at the periodontal pocket area, and there will be swelling of gingival tissue at the periodontal pocket area, and there will be redness of gingival tissue. Sometimes in acute periodontal pocket, the patient will have so much of pain while chewing on that side. If it is right side patient, the patient will get pain on right side molar area or premolar area, even incisal area. Like that, left side also patient will get most commonly in the molar area and premolar area and canine area and incisal area, depending upon, because the peel of an apple or food impaction and husk of rice husk or wheat husk or even chicken fibers also in between the interdental spaces. If there is any food impaction in between the chicken fibers or mutton fibers or any fibrous food of different etiology, will results in periodontal pocket in the gingival tissue. So that in chronic cases, the periodontal pocket will exude the pus from the gingival tissue, because of there will be impaction of chronic irritant in between the gingival crevices and tooth surface, results in while either right side or left side, depending upon the teeth involved in upper jaw or lower jaw, so that patient not even he can't chew, not even these vegetables also, fruits or medium consistency food also, patient will get so much of pain, because the gymphosis, the tooth, the joint between the tooth and the bone is the gingival tissue will be gymphosis, that the joint between the tooth surface and to the gingival tissue by mandibular jaw or maxillary jaw is called gymphosis. So, in chronic cases, if there is a chronicity of the patient suffering with periodontal pockets, will have mobility of teeth. There will be grade 1 mobility, in some cases grade 2 and grade 3. Even it may transform into chronic suppurative periodontitis. So, the chronicity of the vulnerability of this periodontal pocket will leads to chronic suppurative periodontitis, because it will extend the anterior abutment and posterior abutment also, because the infection will spread towards anteriorly and posteriorly. Like that, there will be mobility of these mandibular teeth or premolar teeth spontaneously, because periodontal pockets can be cured by the specialist. The MDS periodontist can clean the oral cavity, and he will remove the causative factor if it is from biting of this apple, the peel of an apple. If there is any impaction in between the gingival crevices, which will leads to periodontal, the swelling of gingival tissue, and it may leads to periodontal pocket. And like that, any hard particle or fibrous particle from chicken or mutton or any herbal vegetable fiber also will leads to this gingival tissue swelling, and it may leads to periodontal pockets. So, the acute and chronic chronicity of this gingival tissue will be cured by the periodontist. MDS will clean the all the oral cavity, and even gingival crevices also. He will curate the gingival pocket, and he will pack with the alginate paste, and sometimes some latest oral packs also available in the market, so that the patient will have so much of relief from pain, swelling, and bleeding gums, and halitosis, and pain on pressure, and pain while chewing of any food, even soft consistency food, and medium consistency food, hard consistency food, and extra hard consistency food. He can't tolerate, he can't chew, he can't bite, or he can't grind, not even soft consistency food also. If the patient will have periodontal pockets in the molar area and the premolar area, or even in the incisal area, he can't bite this guava fruits or apple fruits or any incising fruits also. We can't the patient can't bite in the anterior segment of these incisors and up to canines. So, the periodontal pockets, we have to every fortnightly the patient should visit dentist, and the oral prophylaxis and oral hygiene has to be any time clean and neat, and with rejuvenation of blood circulation, and with oxygenated airflow, because this COVID pandemic, because of the contamination of viral infection through the nasal passage and from the oral cavity. So, our oral cavity should be absolutely order free, because the halitosis is a clinical condition in which the patient will have so much of foul smell, or very acidic smell, or very decomposed smell from the oral cavity because of so many oral habits, chronic smoking and constipation, intestinal worm infestation, and so much of chronic suppurative periodontitis, and some aphthous ulcers, and in scrotal tongue, because in scrotal tongue there will be excess deposition of food particles in the crevices and the grooves of tongue. So many factors will influence this bad odor from the mouth. So in these cases, the viral infections and bacterial infections and contagious nosocomial infections and droplet infections and aerosol infections will spread very easily by this unhygiene oral cavity, or halitosis problem, or this hopeless oral conditions. So the dentist will clean and remove the food impaction, impacted fibrous food, or peel of an fruit, or peel of any husk of rice or wheat, or sometimes the husk of cereals or pulses also. So he will remove the gingival crevices, and he will remove the husk or impacted food, and he will curate the gingival pocket and discharge the pus and purulent exudate from the gingival pocket by using curators, very minimally invasive surgery, so that the patient will have so much of relief from the this periodontal pocket. So this periodontal pocket is not a, don't take it as a simple condition. It is if it is the acute periodontal pocket may leads to chronicity of total mandibular arch or maxillary arch fully may affect with this periodontal chronic periodontitis, and patient will have so much of foul smell, and there will be so much of bleeding gums, and there will be food impaction, and there will be tartar deposits because the patient can't brush at the affected periodontal pocket area, so that there will be food impaction and food stickiness of food onto the tooth surface and the gum tissue will leads to so much of bad smell and foul smell. So the segment, the half of the segment of molars and premolars and canines and incisors will be affected, and there will be mobility of all the teeth, and the patient can't chew on that affected side, and immediately patient should visit dentist, and the dentist will give relief by doing scaling, hand scaling, or cleaning with cavitron, physical vibrations of particles of matter, and he will remove sophisticated instrumentation by remove the fibers and impacted food items and impacted husk from different cereals, and he will remove the pulses husk also, so that the periodontal pocket problem will be solved by professional dentist, the periodontal surgeon will do beautiful cleaning, and he will keep the oral prophylaxis in a hygienic condition, and the patient will have so much of healthy inhalation of oxygenated air into the lungs, and patient will have so much of highly oxygenated blood circulation to the gingival tissue of maxillary on the buccal side, and the labial side, and the palatal side, and so much of profuse blood circulation to mandibular gingival tissue on buccal side, labial side, and right buccal side, and lingual side. So the pinkish healthy gingival tissue will enhance the inflow of more oxygenated air into lung tissue. So thank you so much for watching JRTV. Please press bell button so that every update from JRTV will be updated to you. Please comment on uploading videos so that your comments are our best stimulations. Your comments are our best energizers. Your comments are our best extra added backbone to JRTV channel. Your comments are extra added supporting bonds to JRTV channel. Please share it in your big friend circle. Please share it in your big family circle. Please share it in your big student circle. Please share it in your international clientele circle so that every update from JRTV will be updated to them. Thank you so much for watching JRTV.